Often I get asked why hospitalizations are not considered for people with the borderline personality disorder, especially when they're in a severe crisis, when they're in a lot of pain, or when they are suicidal. Often I get asked, why can't you admit my daughter or son and keep them for as long as it takes and fix them and cure them? Um, it would be wonderful if we could do that. And there is an institute called the Gunderson's Institute in Boston. Um, I'm aware that they do admit people and treat people for a prolonged period of time. Now, in some highly specialized units like that, one can admit people for prolonged periods of time and do treatments. We used to have somewhat a similar model. Uh, we admitted patients for up to 2 years. They actually lived with us for 2 years. And people got well. But when they went back to the community, people again had relapses, unfortunately. So we had created an artificial sort of a situation. Then we experimented trying that the people would come and stay with us for 3 days a week. Other time they'll go back to their environment. We thought that might work. Even that did not work adequately. So that's for the highly specialized units where experts in the field can work with people with borderline personality disorder. But routine hospitalizations like admitting people to public mental hospitals doesn't help. So what are we going to do in the hospital is the question. I mean, if there is a psychological treatment which can be delivered very quickly within a day or two or a week or two, that would fix that could be done. But we don't have any psychological treatment. You can understand why the talk therapies are not going to work that quickly. And if we had medicines or some biological treatments such as electroconvulsive therapy or magnetic stimulation and things like that, we would do that. None of them are available that could work for people with borderline personality disorder. So hospitalization and then do what is the question. However, there may be some situations where hospitalizations are required and should be considered. It is not an all-or-none sort of answer. In situations where if a person feels that they have tried their best to keep themselves safe, but there comes a situation they really can't look after themselves. They have tried and tried and tried. So for people like that, they might need a short period of time where they need to be in the hospital. So where they can hand over the responsibility of keeping themselves safe to someone else and have a bit of a rest. It's not too much to ask for. So in those circumstances, it's fine. Or in circumstances where people with borderline personality disorder can develop other additional difficulties, such as severe depressions, or sometimes losing touch with reality, psychosis. Those kind of situations, of course, they need help in the hospital. Or if they have significant and severe substance use problems, then for short periods of time they might require hospitalizations. But the point I'm trying to make is that just hospitalizing is not going to help.